Hey, we're the Turd Nerds. We're glad you're here. Before we take the plunge, let us introduce ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and licensed acupuncturist specializing in digestive, microbiome, and hormone conditions and integrative fertility.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and functional medicine with a special interest in combining standard therapies with lifestyle and nutrition-based interventions.
And I'm Dr. Alana Gurvich, a naturopathic physician, licensed acupuncturist, and a fellow of the American Board of Naturopathic Gastroenterology. I specialize in IBD, IBS, and other functional GI disorders. Let's dive in.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
We're excited about this episode. We have a lot to fit in.
I'm scared. I just want to say.
Exactly. I know we have a lot of mixed emotions about this, but we are fortunate to have the Dr. Crane Holmes with us today, who specializes in a lot of things that we don't, and that is why he's here. So today we are covering parts of Lyme.
So this is going to be like a 101 super basic Lyme and co-infections.
Yeah.
To ask Dr. Holmes to do this in 30 minutes is borderline cruel.
Yeah.
Just so we're on the same page.
Loaded topic.
But I am positive, based on the amount of patients that I send over to Dr. Holmes, this is one of those things that is causing a bunch of chronic GI issues that I don't know how to address. So tell us everything, Dr. Holmes.
Yeah. I can talk really, really fast.
Yeah.
We can get things
This
rolling
is
if we want
mainly an
to.
East Coast
Well,
room.
why don't we start with how does it relate to gut issues? How does Lyme even relate to gut issues?
Yeah. And so, right, when we're talking about Lyme, so that's where we get nuancical, right? Like Lyme gets thrown around quite a bit. So Lyme is Borrelia, right? So, and then of Borrelia, there's hundreds of species of Borrelia, and Lyme is just one of those species of Borrelia, right? So that's why I'm doing that. All right. But anyway, so we think about Lyme, like Lyme is a general word. Kind of like it's like almost like now like SIBO's become a general word.
Yeah.
I mean, like any sort of gas and bloating and weird, right? So with Lyme, we think about them being as like stealth infections, right? Or vector-borne illness or other sorts of bugs that are just like causing issues outside of just like microbiome imbalance. So these are actually bugs that are like embedded in our tissues that aren't supposed to be there, right?
Is there, and I feel like there is, I feel like somebody starts talking to me about co-infections and I'm immediately like the teacher in Charlie Brown. It's like, wah, 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 wah.
Absolutely.
I know as a fact that people talk about these co-infections and they talk about them that some that are really localized to the GI tract. Which ones?
Well, that's the funny part is like for a while, like, so last year, 2 years ago, I did a whole talk on Bartonella and I was like, it's all Bartonella. Everybody has Bartonella. Bartonella is the problem.
Is Bartonella the problem?
Babesia now, I've been doing a lot of, now like Babesia is the issue. Babesia is the problem. Like everyone has, so you would think, right? And then I think that it's like everything that that's like kind of the fun thing about medicine. Like everything you learn, like every 2 years, you unlearn everything.
Yeah.
Oh, wow.
And then relearn it.
I think there was an East Coast study on pediatric IBD patients where they found like Bartonella and or Borrelia in tissue samples in the GI tract for pediatric cases of significant GI disorders.
I mean, so it's a route in, right? That's why this is important. It's a route in to be able to help these folks that just aren't getting answers. It's just freaky deaky.
Yeah, absolutely. And especially like right in our regular GI world, most people are familiar with the idea of biofilms, right? And Bartonella and Babesia are some of the worst biofilm creators.
Yeah, so we do have a couple of biofilm episodes out there if you want to go look earlier. When I was looking at how I'm going to do my GI disruption prior to stool testing for biofilm disruption, I was like
the provocation.
Like the provocation stage. I was like, you know who's been treating biofilms forever? Lyme docs. What are they using?
Very good point.
And that's how I ended up with it. Do you think Lyme and co-infections cause more biofilms than normal?
They technically make more aggressive biofilms.
So like the biofilms are thicker and more difficult to disrupt.
I think that's a good way to put it. Yeah.
Okay.
It just like Candida typically makes more aggressive biofilms than like bacteria, but like Pseudomonas also make, right? And like, to your point, like other biofilm experts are like, if you see Pseudomonas or if you see this and on a stool test, they have, right? Like, so it's
very
like
suggestive.
Same idea.
Okay. So is it Babesia? How does Babesia present? Is it Bartonella? How does Bartonella present? Like, I don't.
Yeah. So,
or do you just need to test?
So we'll start with Lyme. So Lyme is Borrelia, right? Like Lyme, the classic Lyme stuff is migrating joint pain, right? A lot of people who have joint pain symptoms, we think about Lyme, right? But in our world, I mean, I don't know about you, right? A lot of my EDS patients also have joint pain. So is this just pain?
Is it migrating? I guess I never saw that a lot with people. Do you have patients that are like, I mean, Dr. Horowitz talks about that. Like if they tell you it's like here one day and then a few days later it's this joint. And I never really saw that with people. Do you see that?
I do. And like, as right, we know that
Maybe I didn't ask.
well, you kind of have to ask the same questions 6 different ways, right, to actually get an answer. But, I mean, there is a lot of people where it's like, yeah, sometimes it's my ankle, sometimes it's my hip, sometimes my knee, sometimes it's all right. Like, and not always, but.
And with EDS, does that happen as well? Given the
they're more likely to go out. They're more likely to have little injuries.
Right.
So
I feel like with EDS is typically like I see more of like, oh, it's always my neck, or it's not always, but it's a lot of like my main problem there is my neck and my shoulder, or like every night I sleep, my hips hurt, and that kind of something more like EDS kind of stuff, but not always.
Yeah.
Okay, so Lyme, the first thing, more than any GI stuff, you're looking for that wandering joint pain.
Yeah, I'm asking about joint pain. The other big things that I see about Lyme is brain fog and like neurological symptoms, like that would be the two big things that I see specifically for Lyme.
This just makes me nervous. I thought the mold one was bad. I know.
Should get a laugh track.
Sorry. So I was always like, Lyme disease happens out of Lyme, Connecticut on the East Coast. That no longer is true, huh?
Yeah. And the other thing too is it's not just ticks that spread Lyme. So that's why it just makes it even more complicated. Mites, spiders, fleas, and then I mentioned Bartonella. Like they have found Bartonella in like whales, dolphins. So like talking about things that are like in the ocean, like where, you know what I mean? Like,
Karen, I don't think you'll ever be invited back on this podcast.
Cool.
I am very frightened at this moment in time.
My jaw's just dropped this entire episode.
Okay, so wait. So Lyme is wandering joint pain, brain fog. And I do feel like,
to whales.
One of the things, no, that's Bartonella.
Yeah.
I will say,
keep your P's straight. Lots of P's.
One of, I'm always like, okay, fungal overgrowth or mold has brain fog. But mold does not generally have joint pain that I see. Is that correct? Are you guys seeing joint pain?
Unless they
a lot of people have pain, but I guess I didn't see them migrating joint pain very much,
I mean, everyone has pain because no one sits right,
And just sits. Okay, so now let's go on to Bartonella next.
And I will say, like, people with Lyme don't have to have joint pain. Like, they really don't. And this is also right. This is just my 2 cents. And I think if you talk to a lot of people who are doing and have been doing Lyme, I think a lot of people now feel like the co-infections, like the Bartonella and the Babesia, are actually the bad. Like, we used to call it Lyme and co-infections, and now it's almost gone flipped on its head, where it's like co-infections and
like
Lyme.
They're more severe in symptom presentation.
Yeah.
Are those the only 2 that I'm looking for?
Bartonella, Borrelia, which is Lyme. And then Babesia, so 3.
Okay, so can we go one at a time?
Absolutely.
Wait. I want to, like, when are you, these are symptoms that everyone has. So is it like we used to be taught if they traveled to the East Coast, that's when
or if they had a target rash.
Right. That's when we should be suspicious. But is there any other guidance on when we should be suspicious other than the symptoms a lot of people have?
Yeah. I mean, I have patients who have never left Lake Oswego who I'm treating for Lyme, right? So it's
everywhere.
Yeah. I mean, they've done studies, and in 40% of stray cats in California, they have found Bartonella. 40%. So it's
I never like
where?
California.
One of our mentors, he was like very anti-cat. He would never recommend having a pet cat. Sorry if you've got a cat.
I mean,
my dad is very opposed to any animals.
Oh, really?
Even dogs, yeah.
But they're good for your microbiome.
Right. And I forced my cat into his house, and he tolerated it.
Oh, when I was
moving back, he tolerated my cat until the cat died, but that man does not like animals because he thinks of every animal as just a vector of disease.
I thought dogs are
okay. They are vectors of disease, and they lick you. You make out with dogs. The dogs are lickers.
Speak for yourself, Lana.
Yeah.
I was going to say, I'm saying I had that conversation.
Okay, so we ready to move on to the next one?
Okay, yeah.
Bartonella?
So basically just to recap, traveling places doesn't matter like it used to. It's everywhere.
Yeah, and even the bullseye, like the whole classic idea of like a bullseye rash only occurs in like 20% of the population. They actually also think that we think about that with Lyme causing a bullseye rash, but they're actually saying maybe some of the other bugs can also cause a bullseye rash. Right? What we know is we have no idea.
So
like for a lot of
if you get a bullseye rash, get on doxycycline, but otherwise you might have.
So there's acute Lyme, right? You get a bullseye rash, and that's kind of like an acute Lyme, right? And that's you're 100% right. Like doxycycline is like one of the main treatments for acute Lyme. And then there's tons of conversation, like, well, for how long, right? Because there's there's like the CDC consensus, but then there's no consensus
CDC
otherwise.
says 3 days or 3 weeks.
Yeah, I mean, I think they're saying a month now. Yeah.
Okay. Okay, so then what's next?
Yeah, so the next one, so Borrelia is Lyme, and then Bartonella. Bartonella is a bacteria. Bartonella is cat scratch fever, right? We all learned about cat scratch fever in school, and that is Bartonella. Also, trench foot that was happening during World War II was also Bartonella. Yeah.
I saw it when I was a student treating like homeless youth. I did most of my training with homeless youth. I saw trench foot.
Mhm.
I had no idea that was Bartonella.
Well, there's the gangrene version, and there's some there. I think it's trench foot, but it was spread by rats. Like it was
Huh.
because these people were like living in trenches, right? And there was so many rats, and it was spreading
Oh my
Bartonella.
God.
They got bit by rats and then got Bartonella.
It's typically the fleas. That's how you get it from cats too. Is it's from fleas. I know.
I'm itchy. I'm uncomfortable.
Yeah. So what happens is the fleas actually carry the Bartonella, and then the fleas are on the cat, and then the fleas have flea dirt, right? And then the cats are cleaning themselves and licking themselves and cleaning themselves, and then they scratch you, and they have flea dirt underneath their claws, and then that's how it transmits to people.
Whoa.
I guess I'm grateful for this information, I think, but this is a lot to take in. What do we
you
do
treat
about
cats for fleas regularly?
Yeah, I mean, we treat our dogs for
You're
fleas.
supposed to.
And
Mhm.
cats.
Okay.
Yeah.
Okay.
Yeah.
So
Just
what do we
reducing
do?
fleas. Well, we all go live in Antarctica where
You're
there's
sealed. Done.
nothing
Can't be
can
on a boat.
live.
I would be suffering from COVID.
Okay.
How does it present?
Yeah, so Bartonella, the big things that I see with Bartonella, so Bartonella could cause digestive. So it lives in mucous membrane. So the gut lining, the bladder lining, the lung lining,
Ooh.
right?
Sinuses.
Blood vessel linings, right? Things along those lines. And that can produce right. And then our immune system is trying to attack it and trying to get at it. And that's what causes the inflammatory response. So there we have symptoms, right? So we can get like those interstitial cystitis patients or those chronic IBS patients that like just kind of have this inflammatory picture.
Is it a lot of histamine mediated inflammation?
Yep,
or-
it certainly can be. And one of the keynotes I see with them, right? Like this is right, is like I eat everything and I get bloated, right? Like I drink
Mhm.
water and I get bloated. That's what makes me think about something like Bartonella,
Yeah.
See, that's what makes me think about something like MCAS.
which
Histamine.
which
All
the
histamine.
Bartonella could drive the MCAS for
Yeah.
sure.
I felt so comfortable on mold driving MCAS. I got that.
Mhm.
Now I have to think about Bartonella.
Mhm.
Luckily, we have green.
Thank
Yeah.
God.
And
Yeah.
Babesia. Yeah, and that's the conversation I have with all my patients, right? Like with the MCAS thing, like getting diagnosed with MCAS. And my thing is like, yeah, but why, right?
Yeah.
Yeah, but why?
Yeah,
Like
what's
we could
driving it?
put you on your antihistamines and ketotifen,
Right.
but why? Like why is your immune what's the fire you're building like is just stuck and your fire just can't get put out? Like what is the thing that just like can't get put out?
Okay, so then Babesia. Babesia is the
Babesia.
last one. Tell us about the Babesia.
So Babesia is a blood parasite. And the same thing is it's close to malaria. It's similar to malaria.
Blood parasite.
Yeah, and same thing. There's multiple different species of that as well, but it typically lives in the blood vessels. And with that one, we see like shortness of breath, we'll see air hunger, we'll see POTS-like symptoms.
Huh.
So a lot of people will present with like lightheadedness, dizziness, things,
How do you get this
anxiety,
one?
same, all those different vectors that can,
And this is also a bacteria. Babesia is also a bacteria.
it's technically a parasite.
Parasite.
Yeah.
Okay, so we've got a spirochete, which is
Bacteria.
a spirochete isn't a bacteria, isn't it its own thing?
Spirochete is in the bacteria.
Bacteria adjacent, but it's like basically
Separate.
it's like syphilis.
Okay.
Mhm.
So we've got a parasite, a bacteria, and a spirochete, which is like a bacteria but different.
Yeah.
Okay, and they like to travel together?
Yeah, it's like that old joke, like a spirochete, a bacteria, and a parasite walk into a bar, right?
Oh,
Yeah, it's like that.
Walk into your blood system. One resides on your mucous membranes, one is in your blood, one is in your joints.
Yep.
And so basically, is it more common to pick up the co-infections with a Lyme disease primary, or they're not even related? They're just a conglomeration that we discovered together.
It's just the vectors are similar, maybe?
The vectors are similar, right? And that's the one thing that I learned at one point that was just like mind blowing. So for Borrelia specifically, right? So they used to believe that a tick has to be attached to you for 10 minutes to transmit Lyme,
Ugh,
right?
What are they going to believe now?
And
I
the
hope the answer is 20
reason
minutes.
is that within 10 minutes, the Borrelia in the belly of the tick could change its DNA to better fit its host. So when that tick takes your blood, the Lyme disease morphs its DNA so that when it injects in you, it already has a leg up within 10 minutes.
Why haven't they taken over the world?
I mean, they basically kind of have.
I need something uplifting. Do you have anything uplifting? This?
Yeah.
Okay, so we know what they are. We've
Mhm.
called them. Testing is exceptionally controversial.
And vague. Yeah.
Yeah. So can you talk us through what are our testing options? Are the testing bullshit? Is it real? Like,
Yeah. Yeah. And that's the other thing too, is like, I know we're talking about gut stuff and we talked about mold in the last episode, but man, it's like, it makes me wonder how many people are walking around on like antipsychotics, antidepressants, blood pressure medications, pain medications, insomnia medications, like can't get pregnant, like all these things that we've all talked about. And it's because of like their living situation. It's a lot of these different things that are causing a lot of issues for a lot of people.
So I just want to plug my dad, Dr. Michael Gurvich, because he's a holistic psychiatrist and his entire treatment protocol working with these very chronically psychiatrically disturbed patients is getting rid of their heavy metals in their body, detoxifying them from heavy metals, and treating their underlying infections, especially Lyme and co-infections, because he's on the East Coast. So like that actually is how he addresses chronic psychiatric disorders.
Absolutely.
Successfully.
Yeah. And the same thing, like I have conversation with our colleagues here who even are holistic. And it's like, yeah, when these patients are failing 2, 3, 4 psych meds, we have to think about something else is going on. Just like with our gut patients, like, if we tried 3, 4 rounds of different whatever, and there's still not something else is going on.
Yeah. How are you testing?
So it's a great question. So there is conventional testing through like LabCorp, Quest, or like just like standard hospital
Which is looking
panels,
for like Lyme and
antibodies.
bands, right?
Yep, we're measuring antibody response, right? And then we're looking for those bands, like you mentioned. And the way I describe bands, so bands are specifically for Borrelia, for Lyme. The way I describe bands is like they take a Lyme bug and they blow it up into a bunch of pieces, right? And then they match your blood to those bands and they say like, do you have a leg in your blood that looks like the leg of a Lyme disease, right? Because there are some of those bands that actually aren't Lyme specific. It might be like, oh, this is a tail that could look like a few different bugs.
And those are not super sensitive from what I gather.
About 20% is what I've understood.
Okay, so but do you start with conventional testing?
Yeah, I certainly do for some people.
Because if it's positive, it's positive. It's just it misses a lot of it.
Yep.
Okay.
Absolutely.
Okay, but let's say it's not positive. Are you done, or do you keep digging?
Yeah. So then we're going to third party out of pocket testing, and that just really depends on the patient's resources, right? So there is a test for a company called Vibrant Wellness. It's around $450 for a finger prick. I think it's a good test. And I think it's nice because people just perform it themselves at home. They poke their finger, mail it in, right?
More sensitive than the conventional.
More sensitive, right? And then there's just a lot of different Lyme testing companies out there. Another company a lot of people use is called Igenix. That test is like $1,200 to $1,400 depending on what it is.
Covered by Medicare. Medicare does cover it.
Okay.
Yeah.
These are just getting more like the more you pay, the more sensitive the test.
Is that right?
That's the thing is it's like, I've seen both testing that is, you feel like you're missing. So like, that you still feel like you're missing something. Like, and then for example, like Babesia, and that's why like right now my world is like, is everything Babesia? And like Ami was saying, like it's closer to malaria. Like for some people, same thing. I've just tried anti-malarial medications with people, and all of a sudden they have this big die-off Herx reaction, and it's like, well, they have to have it because otherwise, like they would have no response to it.
So we take them to go to India.
How do you differentiate a Herx from a pharmaceutical side effect?
Yeah, great question.
Yeah, it's a good question. So I would say, and that's like always like, it is $1 million question. I guess it depends on what the symptoms are specifically, right? Like I think like oftentimes like if it's like an antibiotic, right? We see this, it's like, they're usually, a Herx can often be like the same symptoms, but worse.
Where
symptoms
like, they're already having.
Exactly.
But dialed up a little bit.
Right. Where like a side effect is more like, I've never had this thing before.
Right.
Not necessarily.
Whole body rash, anaphylaxis.
Yeah. But the other thing too is sometimes they can look like the symptoms of the bug. And that's also could be like, for example, for Babesia, one of the most common like Herx reactions I see is night sweats. So it's like people will all of a sudden develop drenching night sweats while they start on Malarone. And it's like,
how long is this course? If you're using the antiparasitic drugs, how long is the course?
So I was just reading research and this doctor said a year plus.
Wow.
I think where I start is I usually start with 3 months because again, like we think about like Babesia or some of these, like we think about the life cycle of a blood cell. So I usually start for like the full life cycle of a blood cell. So hopefully we start to turn over healthy blood cells that don't have these bugs.
When are the patients starting to feel better? Are they?
Yeah, I would say it's a good question. My biggest clue into like, I think most treatments, right? I'm sure we can see this in like SIBO patients as well. I think the biggest clue that I see is that certain things might get better and certain things might get worse.
Okay.
And that is like that I know I'm on the right path. Like all of a sudden they're having like drenching night sweats, right? Maybe their sleep is terrible, but they have tons of energy throughout the day and their stamina is a lot better and they're less depressed and whatever. Or to your point, like maybe they're having a ton of diarrhea and you're like, is this an antibiotic side effect or is this a Herx?
Right.
And they're having a ton of diarrhea, but like their bloating's completely gone. They're able to tolerate more
then
foods.
You would go beyond the 3 months, like keep giving it at that point?
That's just more of like to know if you're barking up the right tree or not. That's usually the first thing I notice is like, you know, my pain is completely gone, but this other thing is happening. Or my pain is worse, but this other thing is completely gone.
Stir in the pot a little bit.
Are the herbals the same as they've been, or is there anything new? Like,
No. Before we do that, how about herbs? Where do herbs fit in to this conversation?
Yeah, it's just right. It's another antimicrobial, so they do kill things, right? They do kill things, and that's also the beauty of using herbs, and that's like the same we use it for the microbiome is like exactly. Well, and not only that, but something like Chinese skull cap. skullcap, right? Chinese skullcap has really good anti-Borrelia properties. But we know Chinese skullcap can help with like the nervous system and calming down anxiety and helping people with, so like all the other symptoms that they're having associated with it can help with that too.
Do you ever start with the herbs, or do you always start with the pharmaceuticals, or is it patient dependent?
It's very patient dependent. So when I first started, I started exclusively with the herbs because I was nervous, honestly. It was just like the unknown of like, I don't actually, right? And I felt like it was safer. And it was interesting because my most sensitive patients did terrible on herbs.
We have one of those.
Did terrible on herbs.
Yeah.
Like even a drop of something like hair loss or like terrible symptoms. They could take antibiotics till the cows come home. They could take multiple drugs, totally fine. So it kind of forced me to like change streams,
So
honestly.
now are you starting with the pharmaceuticals?
It just depends. It depends on the person.
And then, so if you're starting with herbs, is herbs going to be longer? Is herbs going to be shorter?
Yeah, I think it just the answer, right? I treat people, I don't treat numbers. So it just depends. And oftentimes, I don't know about you, but I love pairing drugs and herbs. So, like I love doing a combination of like maybe we do doxycycline, but then we do like something called cryptoleptis, right? Or we do Chinese skullcap, or like doing a combo of drug and herbs. It's just like when I treat candida, like I'll often use like nystatin with like grapefruit seed or nystatin with oregano oil, right? So you're like kind of pulling on a couple different levers all at once.
And then biofilms. Where do biofilm treatment fit in with the trajectory of treatments?
Yeah. So I've been one of those people, I guess, from the get-go that I usually just start with treatment and just see how the person responds and then add in biofilms depending on how their response is. Like if they plateau, I might add in because I mean, right, there's some people that you start them on even the basic treatments, right? Like even like let's talk about something like nystatin. I know we're talking about fungus stuff, but like there's people who take one nystatin and feel terrible, right? But then there's other people who can go up really fast and they feel totally fine. And then you're like, okay, great. That was the first month. Second month, let's add in a biofilm disruptor, or we're adding like grapefruit seed that also. But also a lot of herbs have biofilm disrupting properties. So sometimes it is just a matter of layering in something that's maybe like feeding a few birds with one seed, right? Like adding in an herb that will treat Lyme, but also has some biofilm properties.
I like that bird with one seed.
Yeah, my name is Crane. I'm not trying to kill birds out here.
That's much gentler.
Thank you.
Do you do any kind of biofilm disrupting before testing?
So yes, not always, but yes. Like, and that's where sometimes it can help getting a positive test. Otherwise, I like biocidin. Yeah. I like biocidin for everything, if I'm being completely honest. I like biocidin.
We are not currently sponsored by biocidin, but if you guys are interested, apparently we love you guys.
Yeah, biocidin. I think it works for biofilms. It works really well for like treating any sort of gut infections. Good for parasite. People using their mold protocols. People using their Lyme protocols. Start with the drop doses. It's really easy. So that's one of my go-tos. I'll start
for
with
biofilm and for treatment.
Yeah, because they get to stay on it.
Do people get better?
They do. Yep.
Finally, some hope.
I'm looking at Dr. Kapadia. Dr. Kapadia also has a pretty long history of treating these infections.
They would if they weren't so like having all these other exposures or nervous system issues. Or
can we talk about the nervous system with these people? Because there's definitely a nervous system component.
Yeah.
So do they have to be doing, brain retraining or nervous system protocols, or not necessarily, or it helps?
It helps. Yeah, I mean, absolutely, it helps.
Is it histamine? I'm just thinking histamine, and histamine is obviously
a
neurotransmitter.
Like downstream effect of all this.
So are most of these folks on some kind of histamine support to help manage symptoms, or I guess when I'm thinking about biofilms and things that secrete histamine or create a histamine response in the body, I'm sort of like, if we can get the inflammation down by supporting the histamine a little bit, do we get better traction in treating this thing?
Yeah, absolutely. I mean, my step one for like literally every patient I see is, I always say, like I use a lot of analogies, but right, we're talking about your bucket, right? What's everything that's in your bucket? Your heartbreaks, your sorrows, your illnesses, your exposures, right? Everything that's in your bucket. Of course. Yeah. And step one is to get the spigot open on your bucket. So that's supporting your liver and your kidneys and your immune system and your nervous system, and try and get the stuff draining.
It's the only time I use the word spigot.
And then we're trying to make the walls of your bucket taller. And that's where I think the antihistamines come in, right? Like I say, like Allegri doesn't get rid of your grass allergy. It just allows you to exist in grass and not feel terrible, right?
Your body doesn't think the grass is killing.
It's just making the walls of your bucket taller. So yep, we're getting the spigot open. We're making the walls of your bucket taller. We're making your vessel bigger, more stable, more secure, so that then when we go in and start scraping the walls of your bucket, right, treating the SIBO, treating the Lyme, treating the Candida, you have room for that stuff to go.
You've taken this analogy farther.
It's always tricky when you're treating patients like this, because maybe like 50% of them do get better and stay better, but then they don't see you anymore. So you don't really know what happened. And then you only see the people
who live their life,
are still having problems.
It is a little bit. I mean,
you'd have to call them up and be like, hey, it's been 5 years. Did you get better or not? I'm keeping it. Trying to keep track here.
It is a little disheartening. I mean, it's a tough population to treat. And also, they don't have the mitochondrial resources
Yeah.
because their bucket is so full of dirty water.
Right.
You know what I mean? Like, it's a tough population to treat.
Well, and also the thing that I find with most of these patients, not always, but most of these patients is like they've probably had this their entire lives or some aspect of this their entire lives. Like I think about that, like, like, I mean, even myself, like I was one of those kids that required a ton of sleep, right? Like, I had tons of ear infections and strep throat and like, like I didn't bounce back as fast. Like I had exercise induced asthma. And now that we learn like, oh, exercise induced asthma is mast cell activation, right? Like, so I mean, a lot of people have had these things or like, we were learning more like endometriosis, right? Like, a lot of people have had these inflammatory responses their entire lives. They just don't know anything different about it.
They just get more diagnoses, and more drugs.
More understanding.
Do you find that in treating folks and kind of getting to the root cause, you're able to get them off their meds, like hypertension meds or things like that?
Yeah. And the reason I say that is because like I've seen people's cholesterol levels, like for example, drop just with treating Lyme and mold,
because
right?
Of inflammation?
I would guess yes.
Yeah, because cholesterol just is an inflammatory response to protect the vessels, right? We're just trying to create more buoys to make the vessel safer.
And I co-treat a patient, really interesting patient, who was, before he saw me, he was on, I think, 3 years of antifungals. He worked with another naturopath, 3 years of antifungals, stalled out, saw me. I tried all my tricks. I stalled out. I ordered the test. I sent him to Crane. At this point, I've been tracking him for like probably 7 years. This is the most resilient after we went after both the mold and the Lyme because he had both. After we went after both, this is the most resilient he's ever been.
Did he live with cats?
No, he does not live with cats.
Yeah, and even
and I don't know if he had a crawl space.
Whales? Spiders.
Yeah, and same thing. Like I see him now every 3 months or so, and like there's probably more treatments we could do. But he feels so much better than his baseline.
Amazing.
That he's just like, I'm okay with just where I'm at right now. Like I'm living my life. Like I just feel better.
Yeah,
and it is just really. I mean, I know what a big piece of the puzzle this is, especially with all those chronic people. I, however, also feel like I don't want to dig into learning it. And I have the luxury of living in a city where Crane is like a mile and a half away from me. You know what I mean? We don't have, providers don't have to do everything, but you do have to get to know your colleagues to know when to refer.
The resources.
Yeah, I mean, even myself, like there's a lot of things that I don't do that I'm just like, I stay in my lanes, I'm comfortable and I'm good at. I know what I'm good at and I just stick with what I'm good at.
Who need your help. So.
Yeah.
I like to say I have forgotten more than most people have ever learned. I don't know how much, I don't want to learn about this topic. It kind of freaks me out.
Oh, I mean, yes, you heard me this entire episode.
And last episode.
It's a lot. It's my nervous system. Yep. Ooh.
Anything else that we need to anything else? This is literally just not even 101. It's like a 0.0001.
Right.
Anything else that we should be keeping in our brain?
As far as like recognizing these patients, it is the thing where it's just like, again, when people come in and maybe they're coming to you or us for digestive symptoms because that's their main symptom. But when you kind of take a step out, again, they check a lot of other review system boxes. Like they have headaches. The other big thing that I see with these bugs is like sensitivities to light, sensitivities to sounds, right? And that could be your dysautonomia, right? Or just an overactive nervous system response. But like, is that what's actually causing it? Is some of these bugs? And it's like, sensitive to all the foods. I'm sensitive to you ask the people and because again, also people don't know their lived experience, but you're like, are you that person when you walk into someone's house that the trash needs to be taken out? They're like, absolutely.
Because they have nervous systems that are just hyperactive.
So hyper. Yep.
Crazy. So I think about this with a lot of my hormone folks because a lot of people with PMS or PMDD will respond to antihistamines too. Do you see it impact hormone systems? I mean, obviously.
Yeah, absolutely.
How do you in things like inflammatory hormone disorders, like you mentioned endometriosis? Because those are hard to treat.
Yep, low testosterone. High estrogens, progesterones.
I'm thinking about this as like to answer your question is the histamine folks that we just we can't stabilize them. We're doing all the things and they just need more and more and more histamine support. Something's underpinning it.
Yeah.
Those are tricky people.
Yeah, but I mean, yes, and it's nice to have a different road to go down.
Totally. Yeah.
Because honestly, I feel like I stole out of roads.
Yep. Yeah, you only have so many antihistamines.
Yeah.
Yeah. And that's right. And that's how we treat antihistamines. That's how I treat mast cell, right? We make the walls of the bucket taller, right? And then those people have found, okay, as long as I don't add ... into the bucket, and I keep the walls a little bit taller, like my water level is like stable and I'm good.
Yeah.
But I can't add more than that,
Yeah.
right? And that's like the kind of classic thing that we see, right? Like too much of fill in the blank, right?
Yeah.
Yeah, we want to keep them less reactive so they can go live their life,
Mm.
you know?
This was very insightful.
Totally.
I'm sitting here after 30 minutes into this episode and I still am like, wait, what were the names of the 3 bugs? Where do they go? But I don't care because I'm going to send them to Greg.
All the bees.
Okay, great. Can you tell people where to find you?
Yeah. So I have a private practice in Northeast Portland. I'm on 21st and Halsey. Website, drcraneholmes.com or PDXGI is the two places that you can find me.
Amazing.
Well, we
Thanks for
love
your
having you
brain.
here and thank you for coming to join us.
Yeah, of course.
Thank you, Turd.
Thanks, Turd.
Bye.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.